Pleasant good morning. I am Kadeen Smith, Project Coordinator of the Caribbean Future Forum. Welcome to the fifth episode of our new CaribWebDialogue series, the SDGs and You. This is the fifth in a new series of Caribbean Future Forum webinars, which aim at raising awareness of the Sustainable Development Goals, their relevance to the Caribbean, and how we as a region can achieve these goals. Sustainable Development Goal 3 is to ensure healthy lives and promote well-being for all at all ages. However, NCDs such as diabetes continue to pose a challenge to the Caribbean region, and statistics show that 70% of deaths in our region are due to cancer, diabetes, and obesity. Today's webinar will again focus on a healthy Caribbean, seeking to address some of the major health challenges that continue to face the region. Joining us today for this discussion is Professor Marvin Reed, Professor and Director of the Tropical Metabolism Research Unit at the University of the West Indies, Mona. Professor Marvin Reed is a graduate of the University of the West Indies, where he was awarded the MBBS and PhD. Professor Reed subsequently training with the Children's Nutrition Research Center, Baylor College of Medicine, Houston, Texas, University of Southampton, UK, and Abbott Total Nutrition Program. He served as Director, Sickle Cell Unit from 2004 till March 2013, and since August 2006, Associate Lecturer in Department of Community Medicine and Psychiatry. He is now the Director of the Tropical Metabolism Research Unit, where his main responsibilities include mentoring and providing leadership to the staff of the TMRU. He also teaches clinical nutrition, research methods, family medicine at the undergraduate and postgraduate levels, and provides consultative service in clinical nutrition for hospitalized patients. His main research interest is the effect of nutrition on the oxidative capacity and immune response in man and clinical trials. He has co-authored over 120 peer-reviewed articles and has received the Mona Campus Principals and the UE Vice Chancellor's Award for Research Excellence, as well as in other international awards for research publications. And just before handing over to Professor Reed, I would like to remind you all to stay up to date with our activities through our website at CaribbeanFutureForum.com, our Facebook page, Caribbean Future Forum, and on Twitter at Forum_Caribbean. Please feel free throughout this webinar to submit your questions in the Q&A box below, and we do have time allotted for these questions to be answered live. Without further ado, I would like to hand over to our speaker, Professor Reed.
Good morning, everyone, and thanks, Kadeen, for those kind words. This morning, I was asked to engage the group in a discussion about health with a focus on trying to reduce or mitigate or minimize the consequences of the non-communicable diseases. And so one of the things that I would like to do is really to have a definition of what it is that we are talking about in general. So when physicians and your health policy makers speak about the non-communicable chronic diseases, they are in effect speaking about diseases which result from a combinations of activities that you would have performed throughout the course of your life. Those combinations of activities is often referred to as lifestyle-related activities. So essentially then, we're speaking about diseases or illnesses that for the most part are related to how you eat, what you consume, what your habits are, primarily. And typically speaking, we include in those diseases things like high blood pressure or hypertension, diabetes, commonly called sugar in the Caribbean, obesity, diseases related to your heart, often called cardiovascular diseases, or diseases related to effects on your blood vessels, such as stroke and so on. So within the Caribbean consists of many countries, many nations at different stages of economic development. They also share some common traits in the fact that the majority of them are island states, even though we do have a few countries that are on the mainland of South America. The vast majority are island states. And the other interesting fact about the Caribbean is that we tend to speak different languages, depending on who our former colony was, as well as the fact that there's quite a range in economic development activity. So we have those countries that are considered to be reasonably well developed, and those countries that are considered to be very poorly developed from an economic standpoint. However, when one looks across the Caribbean, one finds a common trend or common trait. And that is that the numbers of persons who are being affected with some of these lifestyle-related disorders are increasing. So typically, when one looks at what we call the epidemiological profile of countries, we find issues such as overweight and obesity being very common. In the Jamaican context, in the adult population between 15 and 74, we have roughly 2/3 of our men and women being obese and overweight. And across the Caribbean, that numbers may vary as low as 1 in 2 to as high as 4 to 5. When we talk about diabetes, the numbers are similarly stark, where up to 1 in 10 in the Jamaican context, moving to as high as 1 in 4 across the Caribbean. Hypertension as well is also fairly common. And when you have overweight, diabetes, and hypertension being common, there's usually a consequence. And the consequence is that people die earlier than they really should from these diseases. And it has been estimated that approximately 76% of premature death in adults between the ages of 30 to 69 are related to effects from your non-communicable diseases. So with that backdrop or that background, how do we propose to reduce this burden on our society? Well, a key driver, so to speak, or a key factor that underlies this particular trend is the whole issue or case of obesity, the so-called curse of obesity. So if it is that we accept that obesity is one of the main risk factors, then it is imperative within the Caribbean context that we seek to understand clearly the biology of obesity. That is, what are the drivers from an individual perspective that leads an individual to become obese? And that's one of the work areas of focus of units like myself at the university, trying to understand the biology. And why is that important? Because an understanding of how obesity arises will give us points of focus for appropriate interventions. We recognize that issues related to obesity, although conceptually relatively simple, and I say conceptually relatively simple because clearly it represents a state in which a person's intake far exceeds their output. So in that sense, it's a relatively simple phenomenon. However, there are many steps between that simple equation. So we understand that there are aspects related to the genetic makeup of the Caribbean peoples. We understand as well that there may be factors related to how the genetic makeup is expressed and how the expression of these genes may vary over the life course of an individual, that is, from childhood all the way up to being elderly. We understand that it may be related to the interaction between the gut, that is our intestine, and the inhabitants of our intestine, such as the microbiome or the germs that actually live in our gut, and how that interaction may play out in respective individuals. We understand as well that issues related to our appetite and how our appetite is regulated may play a role. So that's some of the factors that we think from a biological standpoint, and later on I'll try and expand how it is that we may make some interventions at the individual level to address some of these biological understandings. But we also recognize that our expenditure, the amount of energy that we expend on a daily basis, is also important in the controlling the relationship between our intake and our demand. So if you will permit me a bit to delve some more in at least one or two aspects of our understanding of the biology, we recognize, for example, that when it is that we speak about our appetite or desire to eat, that one of the challenges that we face is that our ability to regulate our intakes varies considerably according to the kinds of foods that we eat. And clearly, if it is that our ability to regulate, for example, the components of our diets, and here, when we speak about our components of our diet, we're talking specifically about what we call the macronutrient content, which is the amount of starch, the amount of fat, and the amount of protein that we consume. The evidence seems to point to the fact that our ability to regulate these components, in particular the amount of fat, is not as efficient as it really should be. And so if you have individuals who have an issue or problem with efficiently recognizing the amount of energy that they're consuming because of differences in the nature of the composition of the diet, then clearly once it is that these individuals are exposed to an environment typically called an obesogenic environment, that is an environment in which you have the availability of large proportions or large amounts of energy-dense food, it's easy to see that incrementally over time, the amount consumed may be in excess of your energy expenditure, and therefore you become obese. The other interesting aspects that we are learning is the fact that in lots of persons, the genes that they inherit and how those genes are expressed during their life course may predispose them to, over time, depending on the environment, get becoming obese. So we understand that, for example, that mothers who are pregnant, their exposures to through their pregnancies may actually affect the growth and development of their children or their child in their tummy. And consequently, after the child is born, certainly a critical period in the child's development, and scientists refer to this period by various names, and some may actually give it a number. So some scientists will refer to it as the first 1,000 days. Some scientists may refer to it as the so-called plastic period. The concept here says that how the child is fed, how the child is nurtured during these early years may in effect affect the ability of the child, or affect the metabolic ability of the child, such that when the child becomes much older and is then exposed to what we call the so-called obesogenic environment, then they are more likely to become obese and more likely to suffer the consequence of obesity. And you see, why are we going down this road? But the fact remains is that as we look at strategies that we would need to implement, what this indicates is that some of our strategies need to be focused at what we call maternal and child health. So moms, when they are pregnant, how they're fed, the kinds of exposures that they have, and certainly in terms of infants, as soon as they're born, how they're fed, the kinds of foods that we give these infants are important considerations for both the individual as well as for public policy makers to ensure that we provide or make the infant as robust as possible can for subsequent bad exposures in life. So these concepts are not just theoretical constructs that scientists sit down and come up with. But as I said, one of the benefits of understanding how obesity arises is that it gives us additional areas for which we can design appropriate interventions so as to minimize the bad outcomes. So when we look at the so-called obesity problem that we have, essentially we have two levels at which we can intervene. And the two levels are not, by definition, mutually exclusive. They're all intertwined and interrelated. So on one hand, we have what is called public policy tools. And at the other hand, at the other end of the spectrum, we have individual related tools. So what are some of the public policy tools that as a Caribbean society, we may wish to engage in trying, as I said, to cajole our population towards a healthier existence? Broadly speaking, public policy tools are really two things, really: taxes and laws and or policies. So at the level of governments, one of the things that individuals may opt to do is may choose to impose taxes on products or activities which the government or the population or the community deems as inappropriate. And so we see the use of these tools, for example, across the Caribbean in trying to minimize the prevalence of smoking and alcohol consumption, since we recognize that these are two sorts of behaviors that are amenable to change and can have an impact on the prevalence of these non-communicable diseases. So most governments within the Caribbean and internationally as well have considerable amount of taxes or taxation on smoking or cigarettes, and as well as taxes on alcohol. And the idea here is to try and make these products far more expensive to the average consumer, with the hope that with the increased expense, there would be a reduction in their usage. And if we get a reduction in their usage, then clearly the number of persons being afflicted or affected by some of these non-communicable diseases, we hope over time would decrease. The new candidate on the block, and I use new advisedly, so to speak, that has been the subject of discussions in some countries and has been the subject of discussions or of the subjects of actions in others, has to do with the role of SSB, which is sugar-sweetened beverages. It is thought, and there's quite a bit of evidence to suggest, that there is a significant correlation between the increase in the consumptions of SSB, that is sugar-sweetened beverages, and the prevalence of obesity. And so with that background, many governments have considered taxing SSBs as a mechanism or technique or strategy to reduce their consumption. The thinking here is that if we can decrease the consumptions of sugar-sweetened beverages over time, we should see a decrease in the prevalence of obesity and a decrease in the prevalence of some of the consequences of obesity, your diabetes and your hypertension. Within the Caribbean, Barbados has been the country that is first out of the block. And so Barbados has instituted a 10% tax on SSBs. But other countries are certainly considering whether or not they want to go this particular route. The other mechanisms at the public policy level that countries have used and continue to use includes laws. The challenge we have is that obesity and the non-communicable diseases requires at the level of governments or levels of countries an intersectoral approach. This is because one has to look at what we call the environment. So one has to look at the availability of foods, what kinds of foods are available, how foods are prepared, and typically foods tend to fall under the ministries of agriculture and fisheries for those who combine them. Other aspect in terms of the what is called value-added products from foods, such as processed foods, whether it be processed meats or processed foodstuff itself, typically manufacturing falls under ministries of industry and commerce. Then you have things like ministries of education, because a large part of the time of children are spent in schools, and in schools that provides what is called a captive audience or captive environment, and how children are fed in school is one important factor which speaks to the prevalence of obesity in children and their tracking into adulthood. And then you have other ministries that are also important. Your Ministry of Justice, the ministry that is responsible for crafting your legislation. And then you have your ministries that are responsible for your environment. Some people may have ministries of land, how land is utilized, ministries related to the built environment, public works, and so on. So all of these ministries and all of these sectors need to actually be working in harmony with a common purpose. And that common purpose is really to try and provide an environment that facilitates a dietary intake which is non-obesogenic, as well as a built environment that facilitates continued or increased energy expenditure, which would lead to improved fitness and improved what we call and improved activities in general. So the other aspect of it as well has to look with the communication strategy or media that the governments or the countries use. Because ultimately, the target is to engage the public in thinking in new ways, thinking about new ways about their health and their well-being. Because at the current levels and the current way of thinking, what we recognize is that this is leading us along a path which is very harmful to our health. So having said that, then the point I'm trying to make is that laws that govern all of these ministries or all of those activities and how these ministries interface with the public are opportunities for consideration in terms of making adjustments so that together we can have, as I said, an environment that promotes health and well-being. So that's it in terms of an approach at the public policy level. And then we now turn our attention to what I call the individual level. How do we go about creating and sustaining a desired set of health and personal behaviors, which will include physical activity, healthy living, effective parenting practice, as well as positive communication patterns, such that we get the desired behavior change that we're seeking. We understand that, broadly speaking, behavior changes involve several domains or several components. It involves the cognitive domain, or knowledge of why we should change or what should we be changing to. It involves the social environment. It involves our emotions and how we relate to one another. And so at the individual levels, on the practical standpoint, there are certain levels or certain points at which we can try and devise or define suitable programs. So if we accept the so-called life course approach, and I'm using that approach to try and make the points easier. If we accept that we start our existence in utero, we start our existence in the womb of mom, it means therefore that in discussing an approach at this point, we need to encourage pregnant moms to eat healthy, and to provide an environment for pregnant moms to have what we call children of normal birth weight. So our health system needs to be designed in such a way that emphasis is placed on maternal health and having good maternal health, perinatal or children outcome. Once a child is born and is at an infancy, we need to ensure that, as much as is practical, that we adhere to the World Health Organization recommendation that children be exclusively breastfed for their first 6 months of life. This is because there is a considerable body of evidence which effectively states that children who are breastfed for the first 6 months of life are more resilient in terms of the fact of their reduced risk of becoming obese when they get much older. We recognize that certainly there are many factors which can impact on a mother's ability to breastfeed. One of the more practical factors has to do with availability of time on the part of the mom because of the exigencies of work, meaning a lot of moms only have relatively short maternal leave. And in many countries, maternity leave is of the order of anywhere between 6 to 12 weeks. And thereafter, a lot of mothers would need to return to work. So one area for thought and one area for consideration is this. If we accept the fact that obesity will lead to some of these chronic non-communicable diseases, and which in turn will lead to impaired productivity during the adult phase of your life, then when one may view the provisions of an adequate period for feeding of their infant as an investment, which would be recouped later on because of less obesity in adulthood. And so, as I said, in terms of the public policy part of my discussion, one thing that individuals or countries may need to look at or should be looking at is their policy as it relates to maternity leave and infant feeding practices. Certainly, after the child has passed that period of breastfeeding, we need to look at the whole aspect of what we call weaning foods and how it is that we transit infants over to weaning foods. And emerging bits of data from some of the work that we have done at the TMRU or the TMRI, as well as internationally, is that parenting practices and parenting styles may have an impact on some of these obesity-related risk factors. And so one of the discussion points is how do we go about improving parenting practices in the various households, in various families, so that we may, as I said, encourage infants or encourage behaviors that lead to healthy living. Certainly, during the early childhood, adolescence phase of life, one of the points that we make is that roughly 30 to 40% of the day, and in some situations as much as 50% of the day, may be spent related to school-related activities. And so one of the factors that we have identified that is also driving what we call the epidemic of obesity at the level of children is the school environment, the kinds of foods or kinds of basically the kinds of foods that are available during their educational time, the foods that canteens serve, the foods that are available around the school, and the fact that oftentimes children may return from school to an environment in which there may be little parental supervision from a point of view of what the child is exposed to eat, and those factors. And so certainly as we think about how it is that as an individual, a child may be able to be encouraged to adopt a healthier lifestyle, we also have to think about the activities or the interventions that we may need to effect in schools. Certainly, as the person gets older and is now in their adult phase of their life, one of the things that we would have to encourage is activities that reduce stress patterns, activities that include a healthy dose of what we call physical activity, as well as continued emphasis on healthy eating practices. An important aspect of healthy eating practices is really a term that I like to use is understanding the foods we eat. Because many people eat because of social norms, what they see their family members eating, what they see their friends eating, and do not necessarily understand the kinds of food they eat, the effect that it has on their body. So sustained throughout the life course would have to be efforts made at improving the cognitive ability, the cognitive knowledge about things that we consume, and the effects that those will have on the body. How to read things like food labels, how to identify the components or the contents of food, how to translate those knowledge into the actual creation of proper meals or healthy meals. Then, during the elderly phase, one of the things we recognize as well is that a lot of these lifestyle illnesses, diabetes, the hypertension, the prevalence or the frequency increases with age. And some of that has to do with the aging effect itself. And so there's this new concept of so-called healthy aging, and some of the activities that we're encouraging or more elderly participants to be engaged in. So I'm going to stop here and address any particular queries, but I'll just summarize by saying the key messages that I'm hoping that we will gain from this webinar are that the non-communicable disease issue in the Caribbean is a real phenomenon. It will impact on the Caribbean's economic outlook because it is a source of premature death, increased disability, and so that affects the productivity of your citizens. In addition to that, the health budgets of the regions are actually going to have to be increased to actually deal or to mitigate these consequences. And in trying to address or trying to reduce these consequences, one has to recognize that it is multifactorial, and at the public policy level, it requires an intersectoral response, which will involve many ministries: agriculture, industry and commerce, justice, your communication ministry, your health ministry. So it's not just a health concern or a health problem. And in addressing this issue, one also has to look at it from a broad perspective of what we call a life course view, looking at how we can improve maternal and infant nutrition, how we can improve childhood nutrition, and how we can improve our adult nutrition, combined with providing an appropriate physical environment which would facilitate improved or increased physical activity such that we can have, as I said, a positive and healthy outcome. I thank you.
I am just going to repeat the question. I realize you weren't able to hear me.
Right. Mm-hmm. Yeah, please go ahead.
Right. So it says, understanding the critical issues of NCDs as identified by the statistics and our Caribbean culture relating to health, what targeted approaches should be taken as per public awareness to the Caribbean communities to reach the most vulnerable? I am of the view that our culture is not changing fast enough, particularly in our older communities with respect to diet and exercise.
All right. So the observation or the perception that the change is not fast enough to minimize or mitigate the adverse outcomes is a perception that is held by many within the Caribbean. But behavior change is something that we recognize on the health side is an activity or process that takes time. The important thing, I think, or the positive part about this is that there's a general recognition among the various stakeholders. And the stakeholders include members of the community, members of the political directorate, members of the health group, international partners, that change is a prerequisite for sustainable development. The fact that we have the stakeholders acknowledging that change is a prerequisite means, therefore, that it behooves us to just try and identify what are some of the possible interventions or solutions. And that's one of the rules of institutions for which I work for, like the TMRI, to try and identify what interventions or what policies may be useful in this activity to get us to make the change we need. We recognize that not all policies, programs, or activities that have worked in other jurisdictions may necessarily work within the Caribbean because we're a unique group of individuals. And so I think the conversation has started, and I must thank the Caribbean Health Forum for being a part of the process of change, because nothing will happen before an acknowledgement that there is a need for change. So I think activities such as this highlights to the community and to all of us in general that there is a need for change. In my discussions, I alluded to certain points along our life course and certain activities within our environment that represent opportunities, targeted opportunities for intervention. How we go about doing them, the priorities that we assign to these various targets is something that we will have to work through.
Okay, great. Thank you for that. And moving right into the second question. Public policy tools, as defined by laws and taxes, do not adequately address stigma, which is a great source of suffering and harm to individuals and families. Should we not consider research and support as public policy tools to help address this problem and recognize how key individuals are in their own healthcare?
Right, and so I agree with with that observation. The fact is, whenever you try to adopt what I call a reductionist approach, which is you try to reduce complex problems into simple things, you will always find that there are areas or avenues that don't quite fit into this so-called reductionist view. I agree that stigma does play a role stigma may actually be a barrier to you being able to effect the changes that you're looking for. If we were to borrow our experiences from HIV, for example, one of the challenges in HIV in trying to have that epidemic under control was the stigma associated with being diagnosed with HIV. the governments of the region clearly responded to that, and certainly within my own countries, we actually passed laws that, in a sense, try to mitigate or minimize stigmatized behaviors, both at the level of the professionals and the employers, with a view to trying to encourage individuals to be diagnosed. So although I said in my talk, and I focus in terms of laws and taxes, yes, when we expand those are still tools that we would have to implement or utilize to try and reduce some of the barriers for change.
Thank you. And moving to our third question. Is there a Caribbean standard code is there a Caribbean standard to code processed food? For example, when you buy something in a supermarket, you can go online and see what is in that product. That's as far as you know.
All right. I know the short answer is there are moves afoot towards doing that. The Pan American Health Organization has recently released some information, some data that looks at foods. But the long and short of it is an activity or process that I think the Caribbean is engaged in through agencies such as PAHO, and ultimately, and it will soon become publicly available, that one would have some idea of the kinds of things that we are consuming.
Thank you. And with the aging populations in the Caribbean, is there an estimate on the health costs of these diseases? I think this will increase health costs considerably. I don't see governments being aware on the long-term fiscal effects of these diseases.
The short answer is that the Caribbean governments, believe it or not, are actually quite sensitized to the fiscal impact of diabetes and hypertension. We can tell you, for example, in the Jamaican context, that it perhaps current consumption on the NCDs is probably about 5% or thereabouts of our gross domestic product, or GDP. So we already have a feel, and that varies across the Caribbean regions to probably as high as 9 or 10%. So we already have a feel on the numbers in terms of the economic numbers or the economic impact that these diseases will have on our budgets. And I think that's one of the impetus. Most people may not realize that the Caribbean region is a region that is actually driving the World Health Organization to focus on these non-communicable diseases. Some of you may have heard of the Port of Spain Declaration in 2007, and then thereafter the UN Summit on the Non-Communicable Diseases, which has basically been championed by the leaders within the Caribbean. So I would say that as a collective group, the governments are appropriately sensitized. Within the Jamaican context, for example, we now have a national policy on the non-communicable diseases, which has been approved by our cabinet and which is in the process of being rolled out, and actually started to being rolled out, because we recognize the tremendous impact that it currently has and what it is likely to have if we are not able to reverse the trends.
Okay, thank you. And moving right along in the interest of time, what are your views on the role of patient monitoring outside of clinical settings as relates to prevention as well as for treatment and diagnosis? For example, the onset of wireless devices for monitoring various parameters or behaviors, example, heart rate monitors. Also, what about strategies that include monitoring, such as is currently done with glucose meters, but for other parameters?
All right. what I would say is that the data that we have is that our current approach to managing chronic non-communicable disease is not working. So if we take a condition such as hypertension, most studies that have been performed in the Caribbean would suggest that the number of persons who are aware that they're hypertensive is relatively low. Some people will say as much as a third, 2/3 of persons who are hypertensive are not aware that they're hypertensive. Those who are aware and are on treatment, the level of compliance is on the order of about 25%. So the fact of the matter is that only a small proportion of persons who should be managed are actually being managed and being managed effectively. So it begs the question is, why is this so? And clearly, one of the things that we have to be starting to think about is how can we empower individuals to more manage or further manage their respective conditions. And technology is one such tool that we can utilize to empower individuals to play a more active part in their own healthcare and in their own health management. So from my own personal perspective, I think that we're going to have to be moving to the direction of more self-monitoring, utilizing technology, to be able to improve our compliance numbers. And hopefully with an improvement in our compliance numbers, we'll have improved outcomes.
All right, thank you. And I think we have time for maybe just one more question. So where do you think the Caribbean excels and has an advantage when it comes to health and health systems?
Oh, the Caribbean has a definitive advantage in the fact of most health system. So one is accessibility. So I'll put that on the table immediately. Most Caribbean countries have a system of healthcare, a primary healthcare system, where individuals have reasonable near geographic access to healthcare. The other component that I think which is reasonably good is the health personnel, the individuals who are at the health centers that I think on the technical side are also very good. I also think that at the level of the policy, most of the ministers of health within the regions accept that non-communicable disease are a major problem. I don't think we have much in terms of convincing there. And what most are trying to do is to try to find an appropriate response within their system to this particular problem. So accessibility, the availability for the most part of drugs, the availability of good technical support, and the buy-in by the various health ministers, I think, are some of the factors that put the Caribbean in a very good position moving forward.
Well, thank you very much. Unfortunately, I believe we're out of time for questions. But Professor Reed, I really want to thank you for sharing with us today. I think it's very important for us to remember that NCDs, it's a real phenomena that will impact our economic outlook. Of course, I want to thank all of our viewers for joining us, all of you who submitted questions. Thank you, Professor Reed, for answering them quite efficiently. I'd like to thank also our partners and the Caribbean Future Forum team. Continue to follow us, follow the discussions on our website at CaribbeanFutureForum.com and on our social media pages, Facebook and Twitter. So again, thank you very much, and I do hope that everyone has a lovely day.
Thank you.